Yes, sir. We have Christopher on the line from Lake Balboa who has a question about essential workers. Christopher, you're live.
Hi, thank you. I have a question. So essential workers they're being relied on heavily right now. You know, and most jobs that are essential are going to be replaced in the future, either by the recession or by automation. My question is, what kind of protections will we be given in the future?
Well, if the focus now is on COVID, obviously there are a lot of jobs that could be replaced by automation 5 or 10 years from now. The economy so far has shown that when some jobs leave, other jobs come. And in fact, prior to COVID, we had the lowest unemployment rate, even though you could certainly have read articles published in, say, 2001 or 2002 saying automation is coming and there won't be any jobs by 2020. There were lots of jobs in January of 2020. So we need a vibrant economy. We need an educational system that makes people eligible for the good jobs that vibrant economy can provide. And then we need to get through this COVID crisis. I do think, though, that responders, healthcare workers, so many people whose value we've always known is now more apparent to us as we rely upon people in the crisis. There have been discussions of saying, well, maybe the federal government should pay people a bonus if they're working at their regular salary, but at an important job. And then you hear from the other folks who say, like the last caller, I'm a non-essential worker, or I've lost my job. And so I think we have to honor as heroes the people who are keeping our society going and are doing it for their regular rate of pay, whether we can give them something extra or whether our focus is on those who are at home or trying to figure out how to pay the rent is something we need to focus on. With that, I'd like to turn to a question sent in by Kathy Velez Moro of Chatsworth, and this is for Dr. Goldman. With daily emerging information on the virus, is there any new information on those that are susceptible to hospitalization and death? And is there any new information on what long-term effects people will suffer from after they, quote, recover?
Well, actually, there is a lot of new information along those lines, and that's an interesting question. I mean, in the first place, for hospitalization, it still holds true that the older you are, the more likely you are to be hospitalized and the more at risk you are for death. And that we're now seeing that there is no magical cutoff in terms of age, that, you're fine until you hit a certain point, and then beyond that point, you're at higher risk. The risk seems to go up with each decade. And so that is something that, and by the way, low when you're younger doesn't mean no, because people in their first and second decade of life also have some risk, just lower risk. But the other thing that's been interesting is the identification actually of a genetic trait or a couple of genetic traits that may be genetic susceptibilities for developing more of the pneumonia, the acute respiratory syndrome that people get from the COVID, which is really the process that seems to lead down the pathway to mortality. And so that's important because that can end up being a clue to the biological system that is in place that's causing the immune system to kind of go out of whack in some patients who actually are dying because their own immune system is is over-expressing kind of inflammation in the lungs. So this has been, I think, a very important finding because it could end up being a key to identifying pharmaceuticals or other interventions to kind of block that effect.
Doctor, if I can
one new thing.
ask a couple of questions. We've got 3 million people in this country who have recovered from COVID. They had it. Now they're free to walk the streets with the rest of us. They're told they're cured. Are a lot of them going to have health problems from this disease in the future, or is it like the flu and, when it's over, it's over?
It's not like flu, because we see that people, months out from having had the disease, some people remain quite symptomatic. And in fact, people who weren't even all that sick in the first place were never in the hospital, but for months and months and months linger on with fatigue, with pains, with tight chest, having trouble breathing, a number of symptoms. How long is that going to go? We don't know. We have to keep in mind the disease has only been with us for 7 months.
And this shows how
it's truly a chronic disease, we don't know.
That we keep Obamacare or the ACA to protect people with pre-existing conditions, because now you've got 3 million Americans with a pre-existing condition that didn't exist 6 months ago.
They now have a pre-existing condition. That is so true. And by the way, those who become extremely ill, that's because of their pre-existing conditions. And if we were to toss the people with pre-existing conditions into a situation where they are unable to get health care coverage, that would be so inhumane.
And look, whether it's COVID or, there are millions and millions of people who have other pre-existing conditions. We got to cover people with pre-existing conditions. And you covered the kind of the racial and age aspects of this disease. Early in the disease's process, I read an article that 2/3 of the people dying are men. Is there a gender disparity when it comes to deaths on this disease?
There is a
and that was an early statistic, so I'm sure that there's something more current.
Oh, it's actually still true. It continues onward that men are more susceptible to this disease. And in fact, it's very interesting that Mr. Milken, my school is his namesake, the Milken Institute School of Public Health, he also supports the Prostate Cancer Foundation. And they are doing clinical trials with a drug that's designed to treat prostate cancer because it seems to have some benefit in men in terms of blocking the very severe forms of this disease. And because there may be, because of the hormonal difference between men and women and the way that this virus uses the receptors on cells, that might be why men are more susceptible to actually the severe forms of the pneumonia and even death.
I'm going to ask people, if they're interested in asking a question, to dial *3. You can reach my staff either if you have an individual concern or if you'd like to make a comment or ask a question in front of literally many, many thousands of San Fernando Valley residents. At this point, I should introduce Paul Koretz, the councilman who I've known for more decades than I will admit to, since our days at UCLA. And Paul represents much of the southern San Fernando Valley. This is the second time he's been a guest, and so much of what's happening is happening at the local level. And Paul, I think you were on when we had a question about what programs are available for renters who can't afford to pay their rent. So if there's anything at the city level, let us know about that. Paul, why don't you say a few words?
Well, thank you, Brad. And like Congressman Sherman, my concerns are first and foremost public health, and we've been working around the clock for the last few months to prioritize that and the financial security of our residents. I'll start by answering a couple of things that came up. One, what are we doing for renters? There's a few programs that we have in the works. There's one that I authored a couple of years ago, not anticipating COVID, but just our housing shortage and how many renters are struggling. An eviction defense program. which would fund those who are being evicted for questionable reasons. It would fund their legal cases in court. We also are seeing an issue that we hadn't anticipated since we enacted a moratorium on evictions, but we found that some landlords are just throwing their people out. So they're bypassing the eviction process and just going into their homes and tossing their stuff out and locking them out. So we are trying to address that legally. I don't think anyone anticipated that as a possibility. And sometimes they're calling the LAPD, and the LAPD don't know who's right and who's wrong. So they don't necessarily help the situation either. So that's been difficult. We have a program in the works to contribute to the rent of low-income unemployed tenants and to help them get through it. And that will also help some of the mom-and-pop landlords who are struggling because it would pay their rent or a good portion of their rent. There's also a small internal program I have in Council District 5. We put in $50,000, I believe, so far, and we will also make small grants to tenants struggling while unemployed, etc., to pay their rent. It's interesting that someone mentioned automation because I actually used to write some science fiction short stories in the 80s about what I thought would happen with the human race and automation. I think we're actually just hitting the point where it's practical to automate a lot of jobs. And I do fear in the next 10 or 20 years, we may see higher employment and need to figure out how to address that. I know we're seeing that problem in our ports where we're automating things that aren't necessary to automate but might save a buck here and there. Also losing the ability for people to watch out for potential terrorist activities around our ports. As far as George Floyd and his tragic death, that has created a lot of controversy throughout the country, but certainly in the city of Los Angeles, around policing and the LAPD. I know we are all in agreement that we need to reimagine law enforcement and to reform the LAPD. I know we will be doing that going forward. There's been a big movement that calls itself defund the LAPD. It essentially means eliminating the LAPD and all law enforcement. I think that's a bad idea, and I've been fighting hard against that. There also has been a proposed cut of $150 million to the LAPD in the city's budget. I opposed that as well. I was able to have that cut directed to less painful parts of the LAPD budget and not the things that would have hurt the efficiency and made it difficult for LAPD to function. But unfortunately, that $150 million cut did go forward, so we'll have to figure out how to maintain our public safety with $150 million less in the budget, which will mostly come from overtime and which will be a difficult pill to swallow.
Paul, I have a couple comments on your comments. As to automation, keep in mind that 200 years ago, 80% of everybody was engaged in agriculture. Now that's down worldwide to 8% perhaps, maybe less, certainly in this country down to like 3%. And somehow we found jobs for everyone else. So maybe I'm an optimist even if your science fiction stories are pessimistic. But we'll see. And it may indeed turn out that machines will do all the work for us. And the only job left will be psychological counselor. I do want to point out that it's funny. If you watch MSNBC and shift to Fox and then back to MSNBC, you think that Democrats, or at least some on the far left, want to defund the police, and Republicans are against defunding the police. It's actually, in terms of voting, the opposite. Democrats passed the HEROES Act, which provided money to local governments that have lost revenue because of COVID. And if they don't get that revenue, they're going to have to cut their budget. And you know the number one thing in the city budget, Paul, isn't it police? So if we can't pass the HEROES Act, and all the Republicans voted against it, and the Republican Senate's refusing, it won't be a matter of should we. It will be we have to cut all city expenditures, and the biggest thing in the budget is the police and other public safety, and of course the school districts as well. So it is critical that city and school districts get money, and then I'm sure that the city council will take a look at the police budget and what is the most effective way to deal with the various problems that we now deploy police to use. At this point, and Paul, I think, will stay on the line to answer questions about things at the city level. We've got a survey question. Not everybody will be able to make a statement during this town hall, but you can make a statement by answering our survey questions, and then I'll announce the answers on the line. That is the percentages of those answering by pushing the buttons on their phone. So question A, do you...
Brad?
Yeah.
Any way I could sneak in one point that I want to
make? Yes, sneak in one point, then we'll go to the question.
Because I sort of got sidetracked by
I know.
Stuff. I do want to point out that my area of focus since this whole pandemic started, and I think I was the first in local government to spot it when I did a motion to look at the issue in January, has been masking. And I've been pushing for a requirement for masking outside the home. While it's not universally popular, for a long time, eventually the mayor took it up and did it. And I think now we need to take the next step and to actually start figuring out how to require enforcement.
Well, Paul, I couldn't agree with you more. You see these people screaming, "I'm an American. Nobody can make me wear something." And look, you can't go outside without pants, and you shouldn't go. And in this city, you can't go outside without a mask. And so,
what people don't realize is how effective it is. The best estimate I've seen is that if everyone wore masks, it would reduce the spread by around 80%. And if you add social distancing to that, even more so. So it's clearly, until we have a vaccine, it is literally the only answer. So we could open up all our businesses and stop killing people with this terrible disease if everyone would just buckle down and listen to Mike Pence, who even advised, I think last week, wear a mask for the first time. So I think it's now universally accepted by just about everyone except the president, and we absolutely need to wear masks everywhere we go, and that will drop the deaths and spread dramatically.
Okay, let's go with the survey question. Do you approve of the Trump administration's response to the coronavirus pandemic? If you approve, press 1. If you do not approve, press 2. If you're unsure, press 3. At this point, I think we're ready for our next live question. Do we have somebody in queue?
Yes, sir. We have Artis from Northridge with a question for Dr. Goldman about blood types. Artis, you're on the line.
Thank you. Yes, Dr. Goldman, I've heard people say that blood type A negative is more susceptible to the virus, and to me that sounds like an urban legend, but I wonder if you'd comment if there's evidence. Thank you.
Well, there is some evidence that the blood type may affect outcomes, and the evidence comes from fairly large studies that were conducted in ways that look to me like they're pretty good. Why that might be the case is kind of intriguing, but what they have found is that people with blood group A seem to have a higher risk than other groups in terms of developing the very severe illnesses with respiratory failure. So I think this needs to be followed up. It might not have anything to do with the actual blood cells. It might be that blood group A itself has a genetic association with other genes. So that's the kind of thing that needs to have follow-up, because it's not one of the most common blood types. It's another possible, kind of intriguing clue, though, about why this virus is making us so much sicker than other viruses that are related viruses, that maybe that marker that causes blood group A is somehow involved with our immune response to the virus.
Okay, thank you.
Thank you, Doctor. We're going to do another survey question, but first I'll announce the answers of the first survey question. Some 12% of those on the line believe that the Trump administration is handling the coronavirus epidemic well. Some 83% say no, and 5% are unsure. The next question, I'm skipping question B on my list and going to question C. Do you think that the recent death of George Floyd in Minneapolis is a type of incident that happens rarely, or do you think it's a sign of broader problems in the treatment of African Americans by police? So push 1 if you think it's a relatively rare incident. Press 2 if you think it's a sign of a broad problem, and push 3 if you're unsure.